And it's just one of those things, nothing I can do about it. And they'll come back to me the next time if something happens, but I'm not going to not do the right thing by the client.
You worked hard your whole life. The last thing you need is to get played by the system. And with us, welcome to the Insurance Wise Guys, where we bring the sharpest minds in senior living to give you real talk, real answers, and zero BS. I'm your host, Paul Barrett. Let's get into it. All right, everybody. Welcome to the Wise Guys Retirement Talk. My name is Paul Barrett. I am the host of the show. Today, we have the pleasure of meeting with one of my favorite Medicare agents, Medicare Mike, the original Medicare Mike, not the guy in Bayshore, Babylon, but Medicare Mike Milligy. So, what we're going to talk about today with my buddy Mike, not the fact that he's been doing this for 10 years, not the fact that he's already on Medicare and really understands it from both sides. We're going to talk about a lot of important things that you just don't see on the YouTube channels, on LinkedIn. You don't get these answers anywhere. And this is just the perfect person to do this for us, guys. Somebody that works even though he doesn't have to, right? This guy has been retired for years, but he loves helping people, especially with Medicare. Mike Milligy, welcome to the show.
Thank you. Glad to be here.
All right, Mike. So we're going to kick this off really quick with some interesting stuff. One of the first topics that I want to tackle, and I don't think a lot of consumers are going to understand right away. So we're going to try and, I want to say dumb it down, guys, because you're not dumb. But when you don't know about something, you don't know, right? There's lots of things I don't know about. But Mike, let's talk about enrollment suppression, right? So enrollment suppression has been going on now for a few years. And if you could just take 90 seconds or so, explain to the listeners out there just what is enrollment suppression and what's going on with coverage these days.
Well, enrollment suppression is something that's been going on. It's just gotten a little out of hand now. Uh, and it's something that I watch all the time. I can't really explain too much about it as I'm learning more about it as I go. And when I started, there really wasn't very much of it, but there's quite a bit now.
Gotcha. Well, we're going to take it a little step further. So with enrollment suppression, it was on my mind. And if you guys want to learn more about it, I just posted a blog on my website. Enrollment suppression typically is this, guys. And most people always think that every insurance carrier wants your business, but they just simply don't. Depending on the area, especially in areas where there's a high population and high utilization. High utilization is a fancy way of saying you guys are taking your damn Medicare insurance cards and you're going to the doctors too much. You're costing them money. Very simple. If they have to pay out more than they take in, this is what happens. So in the last couple of years, Mike, can you think of any major carriers that might have had some push towards enrollment suppression?
Yeah, specifically in my area, United Healthcare and actually, more importantly, Humana. Humana's been making a lot of plans non-commissionable, which means they're shutting out folks like us because we generally bring them a lot of business. And if they don't want us to enroll people, that means they're not interested in getting any more than they already have or not increasing their roles very much. So I'm seeing a lot of that.
Perfectly put. So to summarize that, to make sense for everybody out there, it is very simple. These organizations do not have an internal sales force that would normally give them the amount of enrollments that they'd want to see the growth that they want. And I've been doing this for over 18 years. Mike's been doing it for well over 10 years. And we've never seen anything like this until the last couple of years. So what does it all mean? Very simple, guys. Everything goes in cycles. The cycle right now is this. If you see a plan that's online and it looks pretty good, but you talk to an agent like Michael, myself, or somebody else local, and they don't talk to you about it, it's not necessarily because we're sneaky, we're shady, we don't want to sell it to you. I mean, personally, I know you feel the same way I do. I never sell a plan to anybody. I discuss all the plans I can in the area, whichever one seems to be the best. I want you to pick the one that you like best and kind of stay out of that salesperson mode because your insurance means something different to you, Mike, than it does to me. I'm sure you have different coverage than a lot of people. And it's important for people to understand that not every agent is out there to kind of get you and to sell you.
Yeah, no, actually, I have recommended plans that like the Humana plan. It just worked better for my client with from a medication standpoint. I do a deep dive into it though, and I let them know that Even though some plans look pretty good on paper, the devil's always in the details. Some of the copays are very high. Uh, but I show it to them, and if I recommend it to them, if it's going to work, as I said, on a medication standpoint. So a lot of times they'll work, and that's fine. I'll still be able to advise them, but I'm not going to not tell them about something just on a commission basis.
Awesome. And that's what you should be doing. Let me ask you this. Why would you, as an agent, recommend a plan that's being suppressed?
Mostly because the nearest plan to it, and it really goes by, if I have a suppressed plan versus another plan where all the doctors will accept it, but there's $150 a month difference between medications, and the suppressed plan is cheaper, well, I'm going to recommend it to them. And it's just one of those things, nothing I can do about it. And they'll come back to me the next time if something happens. But it's just something that we have to deal with, but I'm not gonna not do the right thing by the client.
Yeah, absolutely. And I think what a lot of people need to understand too is it's very simple when it comes down to Medicare for people like ourselves that have done this for a long times. We're looking at a couple of simple things. Obviously, budget is always something that comes into play. But before budget, a lot of times we're talking about people's doctors, the hospitals they need to use, and their prescriptions, right? So if you end up being a Medicare Advantage type person due to budget or choice, we want to make sure that you're going to have the best experience. And the way to have the best experience is go ahead, tell them, Mike.
Well, the way the best have the best experiences is if the first time you go to get that medication, you're not getting hit over the head with costs, and the first time you whip that card out and you go see your doctor, they actually accept it.
Exactly. So, so everyone out there is wondering about enrollment suppressions. It's happening a lot. Millions of plans have been canceled since 2024. So many people have been forced to change plans. And yet, the most important thing is always going to be, what happens when you take that card and you use it? We want you 100% to have all your doctors covered if it's possible. You definitely want to have the lowest copays for your prescriptions because some of us don't go to doctors much, but we do take prescriptions every day. And if you take an expensive prescription, your plan is really, really important, right? So those are really the main things that we look at for Medicare Advantage people. And I think that this year is going to be a little different than in the last couple of years. We're going to see a little bit less of the cancellations, but I don't know if you read recently, but Humana is talking about shedding 600,000 clients nationwide for 2027. Did you happen to get a chance to read that article at all?
I did not, so thank you for sharing.
Right. So the reason why I bring it up is because last year, United Healthcare, who is number one in Medicare Advantage, Humana is number two in Medicare Advantage. These two companies together are looking to shed 1.6 million members. Right. And everyone out there is like, what are you talking about? Why would you want to do that? Guys, if they could, they would reach out to every single person out there that barely ever goes to the doctors, doesn't take any prescriptions, lots of generics, and wants to be on their plan. But they can't do that. So they have to take everybody. And when you get forced to take everybody, you have a good plan, guess what happens? It's like VL Sassoon. Everyone tells a friend, and they tell a friend, and they tell a friend, and they tell a friend. And next thing you know, everybody's getting the same plan. You ever run into that, Mike? You sign somebody up, they seem really happy, and then what happens? You get a couple,
I get phone calls,
right? You get a couple
so
phone calls. And then,
I do. But a lot of people don't really understand how this works. And I use this analogy all the time with folks when they ask about that. And if I wanted to start my own Medicare Advantage plan, Mr. Mike's Medicare Advantage plan, and I got 100 people to sign up for it, and 20 of them were using the insurance all the time, and they were on medications and needing all kinds of medical attention. And then the other 80 were basically gym goers. They weighed what they weighed in high school, ate a lot of salads, and never used the insurance. I'd be doing very well. But if you switch that ratio around, and now you have 20 people going to the gym all the time, and the other 80 are horribly ill, I'd be losing a lot of money. So a lot of people don't really understand how the insurance business works. But some of those companies, having taken everybody, I mean, I know they make tons and tons of money, so I don't feel bad for them. But as a explanation to the plan enrollments suppression, that's a good example of it.
right. So, you just talk about them making tons and tons of money. And a lot of the ways they make money probably are more unscrupulous. We're reading about it in the paper all the time about
Yeah.
upcoding and all these different things. And I had to dive into it because I was really curious. Like, you making so much money. Why are we lying, stealing, and cheating? Besides the fact that we're capitalists. And it was very interesting. It was just a couple of years ago that I learned about the medical loss ratios and insurance carriers. And it comes down to there's a very small sweet spot for them where they're allowed to make money. And if they make over a certain amount of money, I never thought this could possibly be true, but they have to pay it back.
Oh, I didn't know
They
that.
have to send the money back to CMS, the Center of Medicare and Medicaid Services. So they want to stay within a certain margin. Once you go over it, you're in the red. If you're too low in it, you have to pay back money. So it's very interesting when you start thinking about. I just thought you had all these members, you got paid for them, and if you have less claims than you have money coming in, it was that simple. But it's not, and that's why I wanted to bring that up because if you take a step back, do you remember when we first started with our brand new field marketing organization?
Yes.
Okay. Do you remember how great it was? Because they were giving us money to market and they wanted
Yes.
us to grow. And you know what? That was because all the insurance companies were much more profitable just 5 years ago. Now, today, if you want any money for marketing, they laugh at us because they're like, well, no, the carriers don't want the business.
Yeah.
Ones that do want the business aren't going to spend any money because they know they can get it for free now.
Yeah. Strange times.
All right, so let's get off this topic because I think most Medicare people out there are probably like, I want to kill myself. I'm learning too much about the back end. Just wanted to
Yeah. Agreed.
we're almost to the open enrollment before you know it. So I want to make sure
Yes.
everybody understood a couple things. Number one, we're going to have changes like we do every year. This year should be a little better than last year. But at the end of the day, the changes happen for a reason. And it's not just because they're big bad insurance companies, right? We have bad actors everywhere. We have agents and agencies that misrepresent. We have clients that I get them all the time. They call me up. Well, what if I use my Utah address? Or what if I use my Colorado address? And all these other things. Everybody wants a good deal. Insurance fraud hurts everybody, guys. The carriers are trying to upcode things. It's crazy. It really is. We're all out for something different. So don't just blame the insurance carriers. I don't love them. They're a necessary evil. If we went to Medicare for all, I promise you, if you're watching this and you think I'm crazy, you're crazy if you want Medicare for all. Look what's going on
No,
here.
just look at Obamacare. I spent some time there, so a little tough. A little tough.
Exactly. So moving on.
Yes, sir.
We're talking about different topics, hopping. Mike, when we think about the traditional Medicare call that you get from somebody that comes to you, what's the most important thing that you learn about somebody or how you help them and handle them? Because I think that a lot of agents think that this is a sales position, and I think it's an educational position. How do you handle an introductory call, and how do you help people?
Well, I try to figure out first, how they're getting their insurance now. Do they actually have to sign up for Medicare in the first place? I have a number of people that are still on employer plans and they don't have to sign up for Medicare. The plan that they're on seems to be pretty good. I try to get a little information on it. At the end of the day, to get a feeling for where they are in terms of what they're paying for their plan and do a Medicare comparison to them. And to do that, I have to do a needs analysis. So I don't think it's a sales call. It's more of an advisory uh, service that we provide based on the information that they give us. And then we in turn give them information back regarding the plans that are available and let them pick one that they think is going to be the best fit for them.
Yeah, without being too cliche, honestly, what is your main goal when you first speak to somebody, A to Z, from like introduction to finally I'm going to enroll them? And it doesn't have to be on just one call.
Well, no, it really is come down to is do they really need help right now? Which is first of all determined if they're going to be signing up for Medicare and if they don't have any other type of insurance like the employer plan. Once I determine that I actually can help them or if they need my help, because as I said, some people don't need my help if they have credible coverage, which is like an employer plan. Then once I determine that, if I can help them, then we'll do a needs analysis and I'll collect some information. Not like some of the robocalls that want all of your information. I just need some basic stuff like doctors and meds so I can begin the process of identifying some good health insurance options for them to accompany their Medicare card. I also give them the Medicare card alone option as well, but I give them the pitfalls to just using that by itself.
As you should. As you should. Perfectly. So you're Medicare eligible, and I love to rub it in your face all the time.
Yeah, well,
People
let's
ask
gonna get there one of these
right.
days.
People ask me all the time, well, which plan would you get? And I don't feel like I should be able to answer that. I'm knocking on wood.
No,
Hopefully, I'm a healthy guy when I turn 65. Hopefully, Medicare is still available when I turn 65. No, just kidding, folks. But Mike,
jeez.
you're on Medicare.
Yes.
What plans have you used since you've been on Medicare?
I've used Medicare Advantage. I did a little stint with Medicare Supplement Plan. I used a deductible Medicare Supplement Plan at one point for a little while, only because there were some hospitals that I might have needed, but I didn't. So I went back to Medicare Advantage. Um, Again, I don't, when I'm talking to a client about all of their options, I try to present it in such a way as where it's easier for them to make the choice based on their own individual situation. I don't push them one way or the other. And they ask me what I have, and I tell them I have Medicare Advantage. And I tell them why. And they'll either go along that way or they'll go along with Medicare Supplement Plan. But I've had good luck with the Medicare Advantage plan. As a matter of fact, I put my wife on one, and she ended up having a sizable heart issue
Mm,
and won Medicare Advantage. And she went to a great hospital for it, got taken care of, and we had co-pays, and she's been fixed, and it worked out very well.
awesome. Awesome. So, just so everyone is watching too, I know a lot of people when you hear no one's trying to push you towards Medicare Advantage, guys. And if anyone thinks Mike's on a Medicare Advantage plan because he's cheap, he actually brings me as a guest a couple times a summer to his golf club where he has a country club membership. We get free nuts. It's amazing. Well, he's not a cheap guy. He's just someone that looks at the bottom line, and that's how I am too. But that doesn't mean that that plan is necessarily right for you, and that's why Mike says he doesn't push, and neither do I. So we know Mike is an agent. He's on a Medicare supplement for a little bit. He's on a Medicare Advantage plan. Anyone listening, you can do that in New York, right? Because we're a guaranteed issue state. That's one of the good things about us in that respect. One of the bad things is, as you know, Mike, what's going on in New York State with the Medigap rates and everything going on because of smart guys like you and I that take our clients that have a hip replacement or need some chemotherapy for the next 3 months and drop them on the
Yeah.
lap of a company like United Healthcare.
Well, it's last 3 years, each year, there's been double-digit price increases. They have gone up astronomically in the last 3 years, and the people that are really getting, I don't want to say hurt by it, but most affected are the ones that don't use the insurance that much. There are people that are on those plans that use them 5, 6 times a year. All those other months that they're not using the plan, they're paying a pretty healthy monthly premium. So, and it's, I don't, and once they go up, they're definitely not, excuse me, coming down. So those are the people that are getting hurt the most. I do have others that are using the insurance, unfortunately, all the time. So they're going to pay that premium, but in return, they're not paying very much of anything when they use the insurance, which is every month.
Right. So, I mean, I don't know about you, but I never want value out of my health insurance. It's the last thing I want to say. Oh, I'm so glad I got this plan because I'm getting so much value. Because you know what that means, folks? You're sick.
He gets some
You got some
problems.
real shit going on, right? But it is a savior for a lot of folks because mentally you feel good and you know I can afford this monthly premium and I know it's never going to be above this if I have a particular plan. And that helps folks out. It helps them manage stress, helps them feel better. So that sometimes that plan just happens to be the best for you. But Mike, tell everybody where we live. How much does it cost for Plan G, which is nationwide the most popular plan?
Well, right now it's $372 per month, and I understand that it's probably going to be over $400 per month next year. I think they've applied for a price increase again, I think. But it's a healthy number. I mean, it's a lot for a lot of the clients that I have to pay that kind of number each month.
Right.
So
And
some of them do, but you know.
before I move on from that a little bit, what happens if you have a couple that wants to get it? Do they get a family discount?
Yeah, well, I think they do get a family discount, but I think it's like $2 a month. So I don't think it's a really. I think they might get another dollar off too if they're when they're using automatic checking deduction. But one of the good things is with Medicare, and I point this out to a lot of folks, is a husband and wife do not have to be on the same plan. So I have a number of instances where I may have a husband that's banged up and he's using the insurance a lot, but his wife goes to one doctor a year, takes no medications. So in that instance, I would explain to them that they both don't have to be on a supplement plan paying the big premium. One of the spouse can be on a Medicare Advantage, which works well and even works well if you have issues, like I mentioned before. But they can achieve some savings by being on two different plans.
Right. And that's a good point to bring up because my next question was, so if you're on a Medicare Advantage plan or a Medicare supplement, do we still have to pay for Medicare Part B?
We do. And I emphasize that because for some reason, some folks, when you're talking about Medicare and then you go into, say, Medicare Advantage, I think because it may be because the prescription drug plan is included with it, but they seem to think that the Medicare Part B premium goes away and they no longer need Medicare or have to pay it. And of course, we both know the answer to that is not.
Right.
You're always going to have that Medicare card and you're always going to pay a Medicare B premium.
Right. And if I was going to ask you if you spoke to the average couple and you sat down with them, do you think they were prepared to pay 372 apiece for their Medicare supplement plan G and 202 apiece for the Medicare Part B premium as well as pay for additional, let's say $42 for their Part D drug plan?
No.
No, right? I mean, we're talking about an astronomical number where you're almost at $20,000 a year in premiums.
Yeah. No, they're not prepared for that. That's why the husband/wife option with two different plans is sometimes a a benefit for them to know that because again, I mean, look, if you have an individual that's using their insurance a lot, paying $372 a month might be actually a great savings for certain things that you're doing, especially if you're taking chemo or something like that. But yeah, I mean, as a rule, they're not really prepared for that kind of monthly number.
Right. The only people I've found that have been pretty comfortable with it are people that don't get a subsidy, that have been forced to retire. They're on the health exchange now. Those people seem to be very excited about it. But anyone that's been on Medicare for 5 or more years, I get these conversations all the time. Well, when can we change? What can we get cheaper? But I don't want to give up this type of coverage. And you go back and forth with it, and there just isn't a solution because you're never going to get cheaper Medicare supplement plans in our area. We live in a guarantee issue state. And for the rest of us,
Right.
you're licensed in a bunch of states. I'm licensed in 37 states. I talk to people from 15 years ago that I first signed up in Georgia. And this adorable couple both got on Plan F and they loved it. And there's like a blind loyalty, particularly I find to United Healthcare and AARP. When someone tells me, well, Jimmy went to the hospital, he had a triple bypass and blah, blah, and he didn't pay anything, nothing, didn't pay anything at all. And I'm like, wow, that's incredible. That's exactly what the plan was supposed to do. So it worked. Congratulations. When you have Medicare Supplement Plan F, for all you that don't know, because it's not offered anymore, it covers everything 100%. You just pay your premium. Now,
Yep.
when I tell you Jimmy and Mary's premiums in 2026, and they stayed on the plan because they're blind loyalty, they're not sick, they don't have any crazy issues now, and they're up there. But these poor folks, we're talking about Jimmy. Wait to this. Plan F when he started was $115. It's now 800. 800 and few
Oh,
to be exact. The wife, because I don't know, women and children first, get off the boat, but we want equality. The woman, same exact age, she's paying only 749. No, so why? He's not a smoker, but that's how the rate goes.
yep.
And that's a tremendous amount. And let's not forget, folks, they're paying $404 for Medicare Part B premium on top of that.
Oh,
But
wow. Yeah, together, sure.
I just don't see how it's sustainable much longer. Uh, and it's a little scary. So moving on, we were talking about the annual election period right around the corner,
Yes.
right?
Yeah.
And everyone gets so excited about it. Years ago, we used to have these wonderful meetings where we would get together. You remember the meetings? They were actually
Remember them well.
people crowded around. You could smell what they had for breakfast and all that fun stuff.
Did I remember that too?
We got so much good information. I was actually excited for these meetings. The carrier reps would come and they would tell us, guys, this is what we're going to do this year. And usually it was, we're lowering this, we're lowering that, we're adding networks, we're getting more dental, we're getting more vision. Now, with this enrollment suppression, nobody wants to tip their hand. It's like playing poker. We don't get the information until October 1st officially,
Right.
and they don't share details. These meetings were called first look meetings. Now they do them virtually because they don't want to waste their time either. And they'll send you these summary of benefits for your area, and you get to see maybe a premium, or it says not available yet, maybe a specialist copay, or it says not available yet. But half the information is not available yet. They show you just a
Yeah.
couple of things like, oh, guess what? We're in new counties now. Most of us don't care what county you're in. We want to know how much it's going to cost and what you're going to cover.
Right.
So, reason why I'm bringing it up is because we're getting ready for these meetings. I'm getting all these emails, and people want to know I'm going to travel here and go there. And my clients are already getting notices. Have you gotten any calls yet? Yeah.
No, I
Oh man.
none. I mean, I actually, you know what? I've had some people on supplements out of state from New York, but the people are getting hammered with phone calls. Hammered. I don't know if it's robocalls or whatever it is, but it's crazy. I had this woman sent me a text yesterday. You getting a lot of phone calls? And actually, I am getting a lot of phone calls. It's mostly spam, so I already have it blocked out. But I think people are getting contacted a lot.
Yeah. So there's a lot of people that are going to be trying to always sell the sizzle, not the steak, so to speak, right? We got all these robo dialers. I get solicited at least 10 times a week from somebody that wants to partner with me from Pakistan, India, South Africa. They want to have live transfers of calls come in. And some of you out there listening probably have received a bunch of these live calls. And they always sound so good in the beginning. Hi there, Mike. This is Paul from Medicare Associates. And we have some agents in your area. And we were wondering if you'd be interested in finding out how you can get more dental, vision, hearing, and money back in your Social Security check. Would you be interested in getting money back in your check? And they say it all front loaded. And I don't know about you guys, but I do want dental, vision, hearing, and I'd love to get some extra money back. Who does? And then the next thing you know, they're transferring that phone call to a licensed agent, guys. This is why you don't want to answer the phone. You say yes. Now they have captured your information. You get on the phone with somebody, and now they just paid $100 to speak to you. They have one goal. How can I make more than $100 back? Because the last two calls stunk, right? So they're aggressively coming at you, trying to tell you anything you want to hear. Think about some things that they don't want to say yes to. Mike, how about the WellCare PPO plan? Can you go to any doctor?
Uh, well, because it's a PPO, you supposedly can, but and you're probably going to have to go to any doctor because the doctor and hospital network is so bad. So, yeah, you can go to any doctor, but going out of network with a PPO is very difficult.
Right. I mean, before I even get into my joke about it, if you start looking at the plans now, many PPO plans, folks, they're definitely not better just because it's a PPO. Yes, there's no referrals, wonderful. But when you have to pay 40% co-insurance if you go out of network, or meet a deductible, then pay 20% if you go out of network, or if you have a plan like WellCare, they don't nobody wants to bill them. So if you go out of network, they're going to say, hey, you pay me and you go ahead and chase them for the money. That's why we don't accept their plan.
I have a story. So I was on actually, it was a Humana plan that I was on, a PPO, and I got referred to a orthopedic guy, and he was out of network. But I thought, you know what? No big deal. I have a PPO. I'll just go out of network, which I did. And what I expected was that the physician's office would just bill Humana and I would just pay a higher copay. It didn't work out that way. It ended up being a $500 bill for me on two visits and a ultrasound reading on my knee. and I got the form for reimbursement for Humana. And first I tried to fill it out, and then I had to call the office to get codes. The billing person was away for 2 weeks, so I had to wait. I finally got the billing person. She gave me the wrong codes. I finally submitted it. It came back. I needed the physician's tax ID. I submitted it. Another code was wrong. Anyway, this went on for probably about 3 months. And here's a news flash. I never did get my $500 back. So I went out of network with a PPO, and that's the result for me. And I can't imagine people that are in there, and I'm not young, but I have people that are late 70s, early 80s. I can't imagine them even trying to do that. It was such a horrible experience.
I agree. I agree. I can't stand it. I get a couple of those calls almost all the time. It happens
Mhm.
usually around middle of January, February, March when we have the Medicare Advantage open enrollment. I'll have some clients call me up, and the call usually starts like this: "You're going to be really mad. Which plan did you switch to?" They're like, "Oh, how'd you know?" Well, kind of tipped your hand there.
That's the only thing that really makes me really bad.
Yeah. Well, they start saying, "Well, this is what happened," and they explained this PPO plan. They talked about me getting money back and all these different things. And they said I didn't go to any doctor. And I was like, "Well, why didn't Paul tell me about this?" Paul didn't tell you about it because it doesn't actually work that way. But what happened was I signed up. I went to my doctor's office and they said, "We don't accept that." And then the agent on the phone that told my client said, "Well, if they say that, you say you have to accept it because it's a PPO." Well, that didn't help. It wasn't the secret password. They laughed at him and they told him, "Sorry, maybe I'll say it louder. You don't understand. We don't accept it. We don't have to accept it. We have the choice to pick whatever insurance we want. We'll accept you. You want to come in, you're going to have to pay for it." Right. So, what do I tell my clients when they ask me if a PPO allows you to go anywhere? Absolutely. So does my library card and anything else on it for you. You go to any doctor's
Yeah.
office you want. Just not going to have coverage. And
Right.
I hope it's better in other parts of the country. I find some of the doctor's offices around here quite rude. They make you feel like a criminal when they look you up and
Yeah.
they can't. Wait a minute, we don't accept this. And then next thing you know, you feel like you're getting arrested. They're so rude. So it's very
They're
important.
not nice about it. But, that brings me to something else too, because I've seen a little bit of a trend with the Advantage plans where they're going back to HMOs, a lot of them. And a lot of people are very, very resistant on that because they feel as though they're very restrictive. But you're almost better off with an HMO, and a lot of them are okay with no referrals now. A lot of them are getting over that way. You're better off with an HMO with a large doctor and hospital network than a PPO with a crappy network.
Yeah.
Because because I tell people all the time, look, PPO, HMO, whatever it is, just make sure your doctors all take it and you have a good sized network so the odds are in your favor that the next guy will probably take it too. You know?
Exactly. Right. There's a lot of that stuff that goes on. People always say, prejudiced people are bad, stereotyping is bad, but Medicare Advantage plans get stereotyped, networks get stereotyped, agents get stereotyped, right? Every Medicare Advantage plan is not equal. In
No.
your own county, in the next county, in any state, there's some plans that are phenomenal. How often do you get the phone call and someone wants to enroll in a plan that we don't even offer in our state? And they're like, "Well, my sister has it." Uh,
Yeah, get that.
"Hmm, where does your sister live?" "Well, yeah,
Wyoming.
okay. Well, does she have room on the ranch? Because that's where you're going to have to do it to get those plans." And it's not a joke, but people need to understand that you see all these commercials and things online. One of the first things they ask for is your zip code because
Right.
if the plan's not available there, you can't get it. That's one of the rules of enrollment. You have to live in a planned service area. So very important stuff, guys. We're talking about some silly things bouncing around. I hope you're getting a lot of good information from this type of stuff in a casual way because Medicare is boring and I'm trying to make it interesting. And I try to bring Mike on to make it a little bit more interesting.
Well, I don't know if that's a good idea, but that's all right.
As we're talking, I can tell you this, guys. I have done easily 8,000 presentations in my life. And out of the 8,000 presentations, I would say close to 90% of the people at the end of a presentation have asked me, "Well, how much is this going to cost?" And that's the first thing I say every single time because I'm not going to explain 25 pages to anybody if they can't afford it. It's just not happening. It doesn't make sense for you. It doesn't make sense for for anybody because why would I get you excited about something you can't afford? But if I know it happens to be zero premium and it's a wonderful plan that has all your doctors and your medications are at the lowest cost of any plan, and I say, hey, this plan's going to cost you $0 additional to your Medicare Part B premium. All you have to do every month is write a check for $0. Can you do that? That same 90% of people say yes. And then they ask me at the end because Medicare is so boring. I lost them somewhere along the way on lab work, x rays, prostate exam. You know, they're like, how much does this cost again? Sounds good. And it usually sounds good because they're like the supermarket, right? You get done with all the shopping, you bring your kids in the aisle, and now they got right at the kids' eye level. What do they have? Candy on the left, candy on the right, soda here, and they just have to have something. That's what the summary of benefits does. All of them end with vision, hearing, dental, over the counter benefits if they have them, right? So they get you all excited at the end, and then you're like, wow, that sounds great. So now we're moving forward to the next topic. I don't know if you saw the news, but the new administration has decided to end the subsidy for Part D. Did you see anything about that?
I did see that.
Okay. I've already gotten phone calls. I'm just curious. Did you have a chance to read about it? Because I had no idea how big those subsidies were until this morning.
I just caught a little snippet of it, but it looks like the premiums are going to be going up. I think they said 10 to 25%, I think. Is that accurate or a little bit more?
It probably shouldn't be quite that much. There's supposed to be a still a law in place to prevent it from going up too much more. But the subsidy, more importantly, was $9.8 billion for the last couple of years to get this program going. And anyone could say, well, the government should just, pay the $9.8 billion. Then they got to tax us again and take it away from something else.
Right.
And it's very difficult because the program, as wonderful as it's been, just like the Affordable Care Act, I've never found anybody that gets free health insurance that's told me, I hate this. It's terrible. Of course you love it. It's free, right? No big deal. Same thing with the Part D folks. Anyone that's been on Medicare for a while or anybody that's taking really expensive drugs that cost over $1,000 a month thinks this is the way it should be. And this is awesome. Fact of the matter is, we were only helping about 8% of the users, that were hitting this crazy donut hole. That was it, 8%, which is still a large amount of people because we have quite a few on Medicare. But what about the other 92%? All right. And let's peel that onion back, Mike. How do you feel as someone that can't qualify for it? And now your premiums have gone up. You take no prescription drugs, but if I get prescribed one, I can't get a Part D plan in the middle of the year.
Right.
Now what happens? You have to have one. But your plan used to be $3.70. You're on the beautiful WellCare plan, and they still have zero premium plans in other states. But here in New York, $3.70 plan is now $42.50.
Yep.
How many people yelled at you because they went up over 1,000% and told you this can't happen and this is unacceptable and you got to fix it?
Well, it really wasn't any fun. Um, and it's probably going to be happening a little bit more. Um, but again, and not to get back on this, but it's a service that we really don't get paid for. Um, and I'm going to help as many people as I can, but there's really nothing we can do about it. You know what I mean? We're the messengers of this, and the only thing that I can do is present them with the options that are available to me, which is available to them. And there's really not much you can do about it. You know what I mean?
Yeah.
That's another thing that's almost a suppression thing where, these companies stop paying commissions. We can't even do applications for some of them. And, it's I guess they're trying to save money all the way around and we're trying to help and we can't. So it's kind of crazy in some ways.
Yeah, 100%. And when Mike says we can't help, what he's saying is we can't lower the prices. The prices are
Right. It's exactly what it
Mike's
is.
one of the few guys that I know that I speak to that actually still helps people. I do it all the time. I have agents tell me I'm out of my mind, I'm crazy. But when somebody calls and they're confused, they don't understand, I just help them. It's easy. But if you're listening, as we get closer to your need for Medicare Part D, if you really want someone to help you, I'm not saying call me, but what I am saying is make it easy for whoever you're going to ask. Have a good organized list of all your prescriptions ready. Be able to have them spelled correctly because
Yeah.
what Mike said is true. 90% of the companies do not pay commissions nationwide on Part D drug plans. So anyone that helps you, be grateful because we are doing it for free. That's it. And most of the time, you know what happens when I help somebody because I'm really nice and I may not sound nice on the podcast today because these topics are a little irritating, but
Medicare wise guy.
I get a ton of referrals. So now I have 6 more people to work for free because I do it. And I'm never going to stop doing it because I can't. That's not my personality. If someone needs help, I help them. But,
Well,
you know,
the other thing is it's the old story. Help me, help you. So I had a fella call me and he says, listen, he had a bunch of drugs. I don't know how many he had. He probably had 15. And I said, well, okay, I'm going to need to, get a list of those. He goes, I'll send them to you. I said, well, you want to email them? He goes, I don't use email. I said, well, how you going to do it? He goes, well, I'll text them to you. So what he did is I guess he went and got one of his grocery store brown bags. He ripped a piece off it and used a very dull pencil, and he wrote down all his medications on it, and then he took a picture of it and he texted it to me. And out of 15 medications, I could read 2. So again, make it easier for us to do it. It'll happen faster. I just thought you would enjoy that. I don't think anybody else did, but what can I say? So
yeah, yeah. All right. So we're getting off topic now.
we are getting off. I'm rambling on here, and that's just generally what I do. Keep going.
Here's the main focus of today, folks. So far for the podcast, I really haven't talked about Medicare. So I wanted to talk a little bit about Medicare, give you guys some ideas. There's lots of questions out there. You want to know about income related adjustments?
Yep.
Mike can help you with that. You want to know about what my enrollment deadline is if I'm leaving work. That's another thing Mike specializes in. I know he told me he helps human resource directors all over the city that are having people age into Medicare now because they just don't know
Yeah.
what to do with them. So Mike takes a look at the census and helps them actually move people off their group plans, put them onto Medicare, not forcing them off, but putting them onto Medicare, saving them monthly deductions from their paycheck. The company then pays for their Part B premium and they get better coverage. And the company, guess what? Their census gets better because they have younger people on there. So they're saving money and the employee is getting a better benefit. So if you guys have questions about stuff like that, Mike, where would somebody reach out to you about getting help with their HR department needs help with Medicare, or even if you're just an individual that has general Medicare questions?
Well, they can start by calling me. My number is 631-774-3786. What a lot of people like to do is to go to my website, which is mymedicaremike.com. And there's a place to book some time with me. Go right on my calendar and we can go into what's on your mind.
Right. And let me just add to this because I more people are booking time with me than ever, which I love. And I think it's because, excuse me, my glasses are getting dirty. Can't see without them. And
Oh boy.
they're finally realizing that I'll answer any question. And I don't pressure anybody. I don't care. I really don't. I love answering questions. I know Mike does too. It's a little bit of an ego thing. If you've come up with something that I've never heard of, I promise you I'm going to find that answer probably within the next couple hours and call you back, even if you're a stranger. We like to help people. That's why we do this, guys. Most Medicare agents that are independent and are brokers are kind of more like us. The people that I want you to watch out for are the 1-800 numbers, or the people that say, get a quote now. Anyone that's talking about enrolling you in a plan today, get this plan. This plan's great for you. And you have plenty of time before you're ready to start Medicare. You got to run for the hills. All right. I'm going to end it on this. I really appreciate Mike coming on, and we're going to have
Appreciate you having me on. Thank you.
because I like to have people that are on Medicare using it also. I'm going to bring some of my own clients on to answer, to tell you stories and answer questions soon. But if anybody listening has a particular question, whatever it is about Medicare, like I said, I love to answer questions. I know Mike loves to answer questions. And there's so many of you out there, and there's not enough good agents. So let me know. I'll be happy to do another podcast episode on it. If you want another topic, So far, we've done stuff with real estate, we've done stuff with property and casualty. What happens when you start getting older, you get dropped for no reason, all these different types of things. Long-term care, we had an episode on that. If you didn't hear that, you definitely should listen to it. It was a great episode with Lenny Cohen, and we're going to keep going. I have some nutrition experts that specialize in senior nutrition, functional fitness people. But I want to do this. I want to give you guys as much answers and admonition so you can stay happy, functional in your Medicare journey. So that's it for us today from the Wise Guys Retirement Talk. My name is Paul Barrett. This is Mike Milligy, and we're signing off, guys. Thank you so much for all of you that stuck it out to the end.
Thanks for having me.
And that's a wrap. Another episode of the Insurance Wise Guys. If today's conversation made you think, good, that's exactly the point. Share this with somebody who needs to hear it, because the best thing you can do for people you care about is make sure they have the right information before they need it. I'm Paul Barrett. Stay wise, stay protected, and we'll see you next time.